Good evening, everyone. This is Sonia Liependorfer here. I wanted to go ahead and get this presentation uploaded on AL or primary amyloidosis because it has a lot of information in it. On the first part of this presentation, I talk about the AL amyloidosis itself, and on the second half, I talk about the two types of cancer that this particular amyloidosis causes. So we're going to get into both of those because they are very important. And I can actually go into the two different cancers themselves in more depth at a later time, but I don't want to overwhelm you with information. All right, now the first thing that you need to know about this particular form of amyloidosis is it is systemic. This affects the entire body pretty much once it starts taking over with protein deposits that are abnormal. They end up depositing in various organs of the body. We're going to talk about all the different organs that they affect and how they affect those organs a little bit later on. But right now, I want you to see this picture that looks like it has a Y on it that's kind of reinforced on the outside. Now, all of those areas in purple, those are the heavy immunoglobulin chains. And the ones that are on the outside are the light immunoglobulin chains. Now, those are the ones that can break off and deposit in different areas and cause problems. So I wanted you to get a visual picture of the actual part of the immunoglobulins that we're talking about. Now, if we're talking about immunoglobulins, we're talking about the immune system. So this has to do with the way that your body is handling things as far as your immune system. When it goes awry, what happens? With this particular type of amyloidosis, for whatever reason, the antibody producing cells start to not function properly. And they start to produce the abnormal proteins in these fibers that don't get bound up the way they're supposed to. And they actually refer to them as misfolded proteins. And there is an actual picture later on in the cancer-causing type that you can tell that it's kind of folded over wrong and it just doesn't quite fit the way that it's supposed to. So whenever we see these abnormal proteins showing up, they start to form deposits on various organs of the body, and it can cause serious damage, and it can cause all kinds of problems from kidney failure to heart arrhythmias to different things that we're going to get into. But this particular little area on the side here on each one, the green areas are the light chains that we're talking about in the immunoglobulin that decide to start, whatever reason, congregating and depositing and not staying attached the way that they're supposed to. Now, one of the biggest organs that these proteins affect is the kidneys. Now, let's talk about how it affects the kidneys because it can cause chronic kidney disease, it can cause nephrotic syndrome, it can cause a lot of protein to be in the urine, it can cause a lot of edema in the lower extremities, and it can end up causing kidney failure. Now, how does it do this? Well, what happens with these proteins is when they get misfolded, they finally get a collection of them that gets to be where they cannot actually pass through the kidneys and filter out all of the waste products that they need to because they block everything off. It gets to a point that it causes the kidneys to shut down. So that's what the problem is with these protein deposits is they get too large. And when they get too large and they can't pass, that is when they start to cause serious issues with the organ function. Now, the one good thing about this particular type of amyloidosis is it doesn't affect the brain. That's the plus side of this one. Now, it does affect the nerves, though. So can be a lot of problems with peripheral neuropathy, numbness and tingling in the fingers and hands. There can be a lot of problems with nerve pain, the burning and the pins and needles feeling of neuropathy. Peripheral neuropathy in the feet, the burning sensations and the tingling sensations in the feet. Can also have dizziness whenever you stand up, and you can have nausea and diarrhea whenever you have try to eat something, because it gets to where it affects the nerves and affects how you are able to digest your food. And we cover that in that section as well. But when all of the nerves are affected, it affects everything in your body's ability to get the nutrition that it needs, the way that it's able to hold on to that nutrition. And then it also affects blood pressure. When you start having problems with your kidneys, it affects your blood pressure. When you start having problems with your dizziness, it's most likely blood pressure or heart rate change related. And those things go hand in hand with this type of illness, with the amyloidosis. It can also cause erectile dysfunction. So anything to do with needing a nerve stimulus or needing a nerve impulse can be affected as far as this particular type of amyloidosis. And that's one of the things that you have to look at, especially if you have a person that has problems with carpal tunnel syndrome. Okay, well, how do these particular proteins, when they build up, affects the heart? Well, it can cause a stiff heart, making it very difficult for it to beat, depending on where the deposits are. It can also cause a thickened heart wall, which makes it more difficult for it to beat. It also can cause shortness of breath. In the medical field, we call it SOB, which means shortness of breath, but a lot of people take that the wrong way, thinking that it means something that it doesn't. And then there's abnormal heartbeat. The heart starts to beat erratically because of all of the excess strain on it. It starts beating either too fast, or it can beat too slow. Sometimes it will beat too fast and then too slow, kind of trying to set itself up for a resting period. And a lot of times these people, their biggest complaint is fatigue. They get fatigued very easily. So that is another way that this particular type of protein buildup affects various organs. And we're also going to go into one more, and that's how it affects the digestive tract, because that is another area of concern whenever these proteins start building up in the organ systems. All right, so how do these abnormal proteins affect the gut? Well, they can wreak havoc on the liver, they can wreak havoc on the intestines and cause nausea, where you have no appetite because you feel horrible, or they also can cause diarrhea after you eat if they affect the way that your body can process the food that you eat. It can also cause constipation if it binds you up after you eat, because it affects the way foods are processed and passed through. There can be weight loss with this that is unwanted because you don't feel like eating, you don't want to eat. The thought of eating makes you nauseated. Or there can be the problem of the food not passing through fast enough, and you have this feeling of fullness before you've actually eaten a good portion of your meal. And if you have that premature feeling of fullness, then you're not getting enough nutrition. So those kind of things are what come into play with the digestive tract symptoms that you see that manifest because of these extra proteins. Now, there are some other symptoms that I want to highlight that weren't really included in that particular list, but they're things that you can look out for, especially because some of these people are asymptomatic for so long and they really don't have any idea that anything is wrong with them for a long period of time. And there is a wait and see period with these people. Be if they don't have anything particularly manifesting in terms of symptoms, then they just don't treat the problem. So these are two symptoms that you can look for and notice. If you see somebody that has the purple around their eyes, where it looks like that they've perhaps been in a fight in their eyes. They've got wounds that are healing around their eyes. It actually can be a sign of amyloidosis, having the extra bleeding in the tissues. Now, another thing to look for is if you see somebody that has an enlarged tongue that has a very glossy appearance. This is another symptom that's kind of not one that you would think about very much as far as being a sign of amyloidosis. But these are very telltale signs that can present themselves before anything else. And you'll notice not only is the tongue enlarged, but it's got kind of areas of bumpiness around it. That is another telltale sign is it will not be smooth in nature. It will be very bumpy in nature, in addition to being glossy in appearance. So these are two things that if you see people that have these type of conditions, you know that they may have amyloidosis and don't know it because they are not having any other particular signs at the time. This is one of those illnesses that can go a long period of time and you don't have any symptoms and you don't know that you have it. It's not until they actually go to the doctor with some of the complaints that we're fixing to talk about that they start to realize that, hey, I've got an issue here that needs to be addressed. All right, now on this particular sheet, I just want to reference some things that were not mentioned on those other areas that I pointed out previously, because it's amazing. The more resources you go to, the more things that you find. And this particular handout here shows not only carpal tunnel, not only numbness and tingling in the fingers and hands, and also it can be in the toes and the feet as well. But you can have problems with weak fingernails tearing easily or breaking easily. Then if you look down below that to the legs, it talks about the swelling. It talks about the numbness and the burning and all in the feet as well. It talks about leg weakness. You can just feel like your legs are going to go out from underneath you. That can be an indication of a problem with the back too, but it can also be a problem with your legs, feeling like they're going to go out and not be able to hold you up. Weak toenails, breaking and tearing of the toenails is a sign. If you go over to the right-hand side on this chart, you see the lightheadedness, you see the purple color on the eyelids or around the eyes, you see the enlarged tongue. But if you go down to the next section where it talks about shortness of breath, palpitations where the heart has an arrhythmia, and fatigue, you see chest pain. Now, why would you have chest pain? You'd have chest pain because of the excess work of the heart having to beat against a stiffened heart muscle. Now, if you go farther on down about where it talks about poor appetite and it talks about bloating and excessive gas, that's where that feeling of fullness comes from that they talked about. You have poor intake because things aren't moving along. You feel full all the time and you really haven't taken very much in. So that's where the unexpected weight loss comes from. And then it talks about diarrhea and constipation. You're not being able to digest and get the most out of your food anymore because your body is not getting the nutrients out of it. It's not holding on to it long enough. Another thing it points out is you need to watch for excess bubbles in the urine as a sign. That person is going to be urinating less because they're having all these big, bulky proteins that are going to be blocking the vessels and making it where the waste products of the blood can't be dumped off for elimination. So eventually they're going to end up having to be on dialysis and have that dialysis machine act as a kidney because theirs quit working because of these large oversized proteins block the vessels and get to where they can't pass, which means that the kidneys themselves don't get the nutrients that they need because they have these big proteins blocking the way. These people also have a problem with having to get up a lot at night to urinate. They can't sleep through the night because they have this constant sense of urgency, which can also be from infection because they'll be more prone to infection, not being able to void as often or as much as they need to. Now, another thing that is interesting with this is it talks about down below that bruising and bleeding easily is a sign with this illness. And so is purple striations in areas of skin folds. So these are things to keep in mind because these are symptoms that were not mentioned elsewhere, but they help give you a better overall picture as to the overall symptoms and what to look for and be concerned about if you start seeing them in yourselves or in a loved one, or if you have a family member that has had the type of cancers that we're going to be talking about in a little bit. All right, let's talk about risk factors for this particular type of amyloidosis. Now, the good news we have with this is that it doesn't attack the brain. That's about the only good news that we have with this particular type of amyloidosis. But 2/3 of the people that get it are male, and most of the people that get it are 50 to 80. However, they have had people as low as in their 20s be diagnosed with this particular type. It is caused by a bone marrow disorder. So if you have anybody that has any kind of bone marrow issue going on, then it's a high probability that this is one of the problems. And if you have somebody that has fatigue, has unexplained weight loss, and it's not diabetes or any other illness that would cause that type of feeling, if they have a lot of swelling in the lower extremities, if they have a lot of GI complaints with their physician, if they have carpal tunnel at a young age and it just progresses as they get older, all these are warning signs that something is amiss. And these people can be asymptomatic for a long time. So when they actually start showing symptoms, things have progressed to the point that organs are being affected. And so that is why they decide to go to the doctor, because they're feeling tired all the time. And that's when things starting getting diagnosed as to what the problem is. So if you have a family history of any type of this stuff, keep this in the back of your mind as something that the doctor might want to test for. Now, as far as diagnosing this type of amyloidosis, they normally do a 24-hour urine collection because they're going to find that there's more protein in the urine of these patients than anyone else. So they do a 24-hour urine collection. They'll tell them to collect it into a big old jug that they'll give them. And they'll say every time you void, make sure you collect it in the container if they don't hospitalize them. Now, sometimes doctors want them hospitalized because they want to make sure that all of the urine is collected, and they want to make sure that that person hits that bell and lets that nurse know every time they go, because they want to make sure they collect all of the urine. They also want to check a blood lab called alkaline phosphatase in the lab work because it can be an indicator of liver issues. They will also check a troponin level, and the troponin level is what you check with to see if somebody has had a heart attack. It is the stress hormone of the heart, and you want to know if they've had a heart attack because of the stiffened heart muscle. So you want them to check a troponin. You want them to check what is known as a BNP, and it is actually the indicator that tells you whether or not there's any kind of heart failure going on. Now, you want the troponin to be like non-existent. You don't want any kind of number with that. If you have a number with that, you know you've already got issues. If you have a BNP, you want that number to be less than 100. If that number is higher than 100, then you know you've already got issues with heart failure. Now, the particular immunoglobulin test that you want is to look at the kappa and the lambda. Those are the light immunoglobulins. Those are the ones you want to test for. There should be more kappa than lambda. If there's not more kappa than lambda, that is when there gets to be problems. There should be more free kappa and then more free lambda. Now, as far as checking for the heart, normally what they do is an echocardiogram. However, some places do magnetic resonance imaging of the heart to check for this problem. It'll be far more diagnostic if they have that ability to be able to do that. Now, depending on the organ that is affected, then they will do a biopsy. They can either biopsy the kidney, they can either biopsy the heart through a pericardial window. They may want to take some tissue from the liver. They may want to take some tissue from the intestines. I mean, there's no limit as far as biopsy as to what they might do to try to find the problem. So just be prepared. If they say the word biopsy, it depends on how many of these organs are affected as to how many biopsies they may actually do to find out just exactly all of the different types of the mismatched proteins that they are dealing with. Now, we already talked about the fact that depending on what's going on symptom-wise, whenever they discover that you have this, they can have a wait and see approach and wait till you start having symptoms. They can decide to start chemotherapy. They can decide to start immunotherapy. Usually, they always do steroids in combination with either one or the other or both. And they are currently doing clinical trials for drugs to help the body get rid of the protein fibrils that build up and cause the deposits. Because right now, their treatment approach can minimize the amount that are formed later on down the line, but they don't really have a way of getting rid of the ones that are already been developed. So the only way to do that is getting people that are willing to do the clinical trials to test these drugs to see if they can find a way to get the body to rid themselves of these extra proteins that it has that are causing the issue. Okay, now I want to kind of transition for just a few minutes and talk about the two types of cancer that's caused by these light chain immunoglobulins here that break off and cause these protein deposits. All right, do you see this picture here? It's showing a protein deposit that's kind of bended over. It reminds me of a piece of tape somebody tore off and then it got stuck on itself. Well, that's what they call these. They call them misfolded proteins. These particular proteins are called Bence-Jones proteins. Now, there's two things that this particular immunoglobulin light chain is known for in terms of cancer. One type is multiple myeloma, which are cancers of the bone. And also the other one is macroglobulinemia, which is a rare blood cancer. It is a non-Hodgkins lymphoma. So we're going to talk about both of these for a couple of minutes. Bence-Jones proteins are produced by neoplastic plasma cells. What do we mean by that? Neoplastic means having to do with a neoplasm, and neoplasm means there is a tumor. It's a type of abnormal growth of tissue that's with that of normal surrounding tissue, and it persists to grow abnormally even if the original trigger that caused the problem is removed. Very important point. I had a friend of mine that had the particular type of cancer that this protein causes. And she ended up having 7 different bouts of cancer of different types related to this protein before it finally took her, and she was only in her 50s. So those very last words there, I want you to make note of. Even if the original trigger that causes these abnormal proteins is removed, the tissues continue to grow abnormally. Very important point. Now, if you have Bence-Jones proteins in the urine, that's indicative of multiple myeloma, bone tumors. And at first, you might not have any signs of it. You might not even know that you have a problem. The first sign you have a problem is usually you have terrific bone pain, usually in the hip. And you go to the doctor and you complain of hip pain, and they do an x-ray and it shows a bone tumor. Well, there's different things that they're going to do for that, and I'm going to go into that, but briefly. But this is a cancer of the white blood cells that produce antibodies that make them fight off viruses and bacterial pathogens, and there's no signs at first, and then this abnormal tissue builds up and forms a tumor in a bone, causes extreme bone pain, ends up causing anemia, ends up causing kidney dysfunction, ends up causing infection. With my friend that had this particular type of cancer, she later on went on to have breast cancer as well. And it was just one thing and then another. And it was sad because every time she thought she was over this particular type of cancer and she looked like she was going to be okay after a couple of years, it reared its ugly head somewhere else. So that is why this particular type, when it says that they continue to grow abnormally, take note of that, because they have not found a way to turn that off totally. They want you to think that they have, but they have not. So how do they diagnose it? They look for the presence of these Bence-Jones proteins in the urine. And in 2/3 of the cases of multiple myeloma, these bone tumors, 2/3 of the cases, they're always present in the urine. And then they do bone marrow biopsies, which I have heard are very painful. I, at one time, signed up to be a bone marrow donor, but they never called me. They can do a special type test called a FISH test under fluoroscopy. And it's a fluoroscopic test that tells just exactly how rapid the cells divide and just how they are abnormal. How they are abnormal is important because it designs their plan of attack against the disease. Now, imaging can go anywhere from X-ray to CAT scan to MRI to PET scan, whatever they think is going to give them the most definitive picture of what they're dealing with. Ultimately, the bone marrow biopsy is going to give them the bulk of the information that they need. Now, with this particular type of cancer, they stage it and then they give it a risk rating. Now, what they do is, depending on what they see with the biopsy, they stage it between 1 and 3. 3 is the most aggressive. Means it's going to attack the most organs and be the most detrimental, the most rapid. Risk is the rating, according to that aggressiveness, on a decision on how to attack it. And if it's already attacking bones and the kidneys. Options are going to depend on where all it's already hit and what other areas that it is going to be looking at targeting. Now, they can do a targeted approach if it's not gone all over the place yet. They can do a biological treatment for it. They can do chemotherapy for it. They can use steroids for it. And they can see if a bone marrow transplant will help. But remember, this bad boy always comes back, always rears its ugly head. Like I said, keep in mind with Big Pharma, they're out to create customers, not cures. They want to make you think you're going to be cured. They are just prolonging the process because there is no cure. And I want to make sure you understand that. Now we're going to look at another type of cancer that is very rare, and it's a different type of non-Hodgkin's lymphoma. Waldenstroms macroglobulinemia. Say that really fast about 10 times and see if you don't stumble on it. It's produced by neoplastic cells as well. There are too many abnormal white blood cells that crowd out the healthy white blood cells. And this is a rare type of non-Hodgkin's lymphoma that results from this light immunoglobulin chain going haywire and making these extra protein deposits. Now, with this particular type of non-Hodgkin's lymphoma, they've actually identified a mutation in the gene of the DNA, at MYD88. And you can be asymptomatic with this for a long time, and it be found on routine blood work. Immunoglobulin M is what spikes, and you'll see that in the lab work. But you better be testing for the immunoglobulins, otherwise you're not going to see it. Now, they start complaining of weakness, fatigue, bleeding from the gums or the nose, unexplained weight loss, bruising, and skin lesions. So some of those are the same as with the regular amyloidosis, but not all of them. But again, being asymptomatic for a long time and then all of a sudden starting to develop these serious problems, by the time you start to actually present with issues, it's already gone on long enough that it's affecting the way the organs can work. That's why you start to have all of these issues. So they do a bone marrow biopsy, and then to treat it, they do a bone marrow transplant, which of course can either work and take or not, but you're still going to have problems later on down the road because these problems do not go away, no matter how much they try to sell you the fact that they sell a cure. They do not sell cures. They create customers. So you're being lied to by Big Pharma, and I'm seeing it more and more now that they're sponsoring the nursing conferences, just how much they're lying to people. And they're getting to where that they're trying to use the advanced practice nurses to basically be drug dealers for them and try to push the drugs for them, which is wrong in my book. It's just ethically wrong. And what we see with treatment is the bone marrow transplant, then they put them on biologics, which biologics to me is a whole nother gamut of drugs I would have absolutely nothing to do with, because again, they are geared and made to change DNA. You can't tell me this is not going to come back and bite us later on. They do have a wait and see approach if people are not symptomatic, but there is no cure. And they try to tell you that there is one because that's what they're trying to sell you. Big Pharma does not create cures. They create customers. And the sooner that everybody realizes that and accepts that fact, and that they don't have all of the answers that they try to sell us that they do, the better off that we're all going to be. I want to thank you guys for being here. I know this was a little longer than what I anticipated for it to be, but I wanted to cover both the amyloidosis itself to do with the light chain, and I also wanted to cover the two types of cancer that are associated with it, all in the same little lump sum, so we could move on to the other sections as we plan to for the rest of the 6 weeks. I also have to say thank you for subscribing. Please, if you have not subscribed already, please subscribe. Please like if you've learned something from this video today. I want to give a special shout out to Wikipedia, the Cleveland Clinic, the Mayo Clinic, and the Amyloidosis Foundation for the fantastic pictures and information that they have available on these topics and the resources that they have for patients and their families to be able to learn from that have these conditions, because they are not very common. So this is the most common one of all of the types that we're going to be talking about. Again, I hope that you learned something from this. I hope you can go back and go over the material. If there's anything that you did not understand, please feel free to leave a comment or to shoot me an email at rnforahealthieryou@gmail.com, and I'll be more than happy to answer any questions that you have. Just make sure in your heading in your email that you put that you have a question, something that'll flag my attention, because I go delete crazy with my emails because I get so much junk mail. So y'all have a great weekend, and we will do this again next week. Hope you enjoyed it. Have a good one.